artificial intelligence to detect the papilledema from ocular fundus photographs. First, we need to define three main terms. First, let's talk about the AI, or artificial intelligence. Artificial intelligence is a term that refers to simulations of human intelligence in machines that are programmed to think like humans and mimic their actions, and therefore their decision-making abilities. Now we're gonna watch a video that explains this term in a better way.
What is AI? Let's start with a question. What do you think the most complex object in the universe is? Try and think of it. I guarantee you the answer is in your head, literally. That's because it's the human brain. Even the most complex networks, the most powerful systems cannot match it. Changing that is the ultimate goal of artificial intelligence. It is not about building a robot, but creating a computer mind that can think like a human. But there are many steps along the way. So-called simple or narrow AI systems are already everywhere. From Apple's Siri to Facebook's friend recommendations, it's in our cars, our homes, even air traffic control. And narrow AI has been around for years, doing one specific task better than any human. The computer Deep Blue beat the world chess champion way back in 1997, but ask it to play drafts, and it wouldn't know where to start. It couldn't learn a new game for itself. It couldn't think as a human. And so, we come back to the challenge, and some say the danger of creating a human or general AI, a computer mind that thinks like a human, that learns, that improves, that could even become superhuman. Experts predict 2050 is the year we could see it, if it is even possible. It's a race worth billions. Some say it will save humanity. Others say it could destroy us. Either way, if and when it happens, the world will be changed forever.
Now, the second term that we must define is the papilledema. Papilledema is a condition in which increased pressure in or around the brain causes the part of the optic nerve inside the eye to swell, therefore causing problems with the eyesight. Now we can see a picture differentiate between a normal optic disc with a papilledema case. And now we will watch a video that explains that a doctor is explaining to a patient what is happening with the papilledema case.
So Ms. Moran, I've been told that I have papilledema. Can you tell me more about that, please?
Yes, so papilledema is what we can see when we examine the back of your eyes, and what that can be is it can be a sign of raised intracranial pressure. Now, it's sometimes not very easy to tell whether people have what we say is papilledema or pseudopapilledema. And what I mean by pseudopapilledema is that sometimes the nerve looks swollen and elevated, but in fact it's not due to brain pressure. So often when we go to the opticians and they look in through an undilated pupil, they get the impression that the nerves are elevated, and that signals for them to send somebody urgently to the hospital to be evaluated. When they come to the hospital, quite often the doctors look with what we say is called an ophthalmoscope. So sometimes they're not able to put drops in the eyes, and they actually look with a torch in the eyes to have a look at the elevation of the nerves, because they need to confirm whether the nerve is swollen or not. If they're unsure, in the emergency situation, they often ask an ophthalmologist, an eye doctor, to come and have a look at the back of the eyes.
More experience of the eyes.
Yeah, and also we've got sort of more useful instruments such as the slit lamp to be able to have a good look at the back of the eyes and evaluate whether we think there's true swelling or whether it's pseudo swelling. So some of the causes of pseudoswelling can be little deposits such as drusen at the optic nerve head. These are tiny little refractile deposits that we can sometimes see when we do an ultrasound of the eye. So we ask the patient to close the eye, we put some jelly on, and we use a sort of device a bit like
an ultrasound.
Yeah, just like on what pregnant mums get to look at their babies. So it's sometimes a very useful way to determine whether there's drusen present or not. But sometimes it's even more difficult than that, because sometimes you can have drusen as well as swelling. So you can see that there's lots of different things interplaying. So it's always important that the diagnosis of papilledema or true swelling in both optic nerves is evaluated before invasive tests are done.
The third term that we're going to define is the fundus photographs, or ocular fundus photograph. This involves photographing the rear of an eye. The main structures that can be visualized on a fundus photo are the central and peripheral retina, the optic disc, and the macula. Now a better explanation in this video.
You may have had a retinal photograph taken as part of your eye examination and wondered exactly what is my optometrist looking at. If you look at this photograph here, you can see this small dark area, which we call the macula. The macula is the most sensitive part of the eye, and in some patients as they get older they develop a condition called age-related macular degeneration, where they do lose some of their central vision. Over to the side here, this slightly unusual round structure you can see is the optic nerve head. You can see that it's sort of pink around the edge, but quite pale in the middle. The optometrist will look closely at the optic nerve, because this pallor which you can see in the middle can sometimes indicate early glaucoma. You can also see quite clearly the retinal veins and arteries. The veins are the thicker ones. They're a little bit darker in colour, almost a purple colour. That's because they're carrying blood which doesn't contain any oxygen, because it's going back to the heart. The arteries are thinner and they're a brighter red colour because they're carrying blood which is full of oxygen, bringing blood to the eye. It's important to look closely at the veins and arteries, because this is where we see changes in patients with high blood pressure and patients with diabetes. The eye, in fact, is the only place in the body where the veins and arteries can be directly observed without making an incision. This retinal photograph is of a healthy eye, but it will still be saved in the patient's record, so that when the patient returns for their eye examination in 1 or 2 years' time, another retinal photograph will be taken and the photographs can be compared, and any changes which are taking place will be spotted immediately.
Now, we're going to talk about the applications in medicine of this type of treatment. Artificial intelligence and deep learning have been developed for the automated detection of diabetic retinopathy and glaucomatous optic neuropathy from ocular fundus photograph. Therefore, there's no problem by using these same processes to detect or diagnose the papilledema. Now we're gonna watch a video about a doctor that developed this type of system.
There's 30.3 million people with diabetes right now in the US, and there's 80 million people who are going to develop diabetes in the next 5 years. It's a giant public health problem. It's the most important cause of blindness in the US under the age of 75. I'm a retinal specialist. As a resident doing ophthalmology, I became really concerned for the people with diabetes that actually I was not seeing, the people with diabetes that came in late and already with a lot of visual loss and blindness where we couldn't do much anymore, and all these people I was seeing that were otherwise normal. And I thought, with my background in computer science, well, maybe a computer can do this better. IDXDR is a system that is autonomous. And it means that it makes a clinical decision by itself without requiring a clinician like me, a retinal specialist, to be there. It's a system where an operator who can be a high school level graduate can take images of the retina with a robotic camera. It takes a few minutes, and there's a diagnostic AI that then analyzes that images for disease and gives a clinical decision whether or not there's disease there. It's all done in a matter of minutes. It doesn't require a specialist like me to make that clinical diagnosis. It's a great benefit because if you're a person with diabetes, you go to the clinic, to your regular diabetes doctor. What is really important to prevent visual loss and blindness in people with diabetes is a regular retinal exam. You're with your diabetes doctor, it can happen right there, then and there in a matter of minutes. Only if it's abnormal will then the provider in the diabetes clinic refer you to someone like me, a retinal specialist, for treatment.
Now we're going to discuss the pros and cons of this topic. The pros are the faster results we can get from this type of system and machinery of specifically the artificial intelligence. This can result in a more precise diagnosis of the cases because it uses exact imaging and process that like people or humans will like may have like not taken account of. Physicians could use the available time to treat other patients because there will be more time or less persons required to diagnose someone. These other physicians that are not like spending time with this type of patients can treat others or treat other cases that they have. Therefore, giving more time for the more available time to treat other people. Now, when we refer to the cons, is where people, like usually older people, don't trust technology. They would not be willing to receive a diagnose or a diagnose from a machine because they don't trust it. They don't feel confident on the results that a machine is giving them. Investment is also required, which could be a con in the case of people that don't have the resources, or also companies that don't have the resources. Even countries with the whole economy. Installations may not be available to everyone because they also need an investment. They need to have the specific systems and machinery for this type of exams. Now we are going to take this into our own country. First, we need to define that Ecuador is a developing country with therefore scarce resources, because specifically talking about the monetary resources. In the case of papilledema, there's no data for Ecuador specifically about the prevalence in this country, but we could take the worldwide prevalence statistics, which state that papilledema cases are between 0.8 to 14% of the cases of intraocular high pressure. Therefore, having these high percentages, we need to take into account that a great matter of the population could have this type of issues. Therefore, needing this type of treatment and the artificial intelligence. In conclusion, we can say that the correct programming and machine learning must be applied to this type of artificial intelligence to build the confidence on patients and people around the world. The tests to prove the accuracy and results must be carefully applied. Also to have this as a backup to give the people confident on the results that they are receiving from a machine. And the systems and machinery should be also available for everyone, or as extended coverage as possible, because as it was discussed later before, as it was discussed before, we need to have investments and have the infrastructure needed to perform this type of exams, and so we need to cover as much as we can in referring to patients. Thank you.